seems like there are many different remote patient monitoring systems popping out left and right, whether it is a solution that encompasses every single device and wearables and monitoring system versus some are truly FDA approved. Others are just focusing on a specific outcome, perhaps it's mental health or perhaps is a heart condition. Now, how do we cut down the overwhelm when we are creating these solutions and knowing how to adapt and which one to even adapt? At the same time, how do we leverage these remote integration systems, not just at home, but while patients are staying in the hospital to make everything easier for our clinicians and staff, and especially those who are needing monitoring in the hospital for one-on-one observation. Today, we have explored these topics at the last ViVE conference. Stay tuned. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Conferences are always the places to gather a lot of brilliant minds and eager people who are there to learn, to collaborate, to connect. And that's why we love to go to conferences. At our last one, we interviewed quite a few innovators and founders and C-levels and also women-led in the place to discover what have they been able to solve a critical issue in the healthcare space. One of them that we are discussing today is led by Lucille. She has been a physician by trade and gone into technology. And then the critical area she found in the larger hospital and health system is how do we create early detections in our patients despite of how quote-unquote healthy or sick they are at home. When they leave our office, leave our hospital, what can we do to help them to reduce hospitalization? She is able to create that interconnectability with all platforms, all electronic medical records, as well as multiple devices into one system. And instead of many point solutions that they are isolated, even though they might be able to detect many different vitals, many people do use different devices. So to switch over can be challenging instead of bringing everything into one place. Let's hear about what she has to say. Hi, this is Sabrina Runbeck here with the Caregiver Worldwide at ViVE. And we're so excited to have Lucien here with us with Rimidi. And then please share with us some of your amazing stories behind this company and what is your true mission and how are you solving a problem in the healthcare space?
Sure. So Rimidi is a chronic disease management platform, and I'm a physician by background, worked in technology before that. And my interest in starting the company was really how do we make it easier to manage patients with chronic conditions outside of the walls of the healthcare clinic. And so, being able to bring data from the patient at home, either from a medical device or them reporting their symptoms to their care team to give them that sort of continuous support that they need and their caregivers need who are taking care for them at home.
Exactly. We know most of the care, once we let the patient go, we actually have no idea what's happening. And it really is depend on the patient and the caregiver to keep them accountable to making sure the right things are being done. And sometimes if we can capture those data points much earlier, be able to communicate and tap in, they don't come back to us of being really sick or have worsening prognosis. So how are you guys able to do this and creating big momentums and wins so far?
Right. So we connect with a lot of medical devices in the home. So a patient who has high blood pressure or diabetes, they're able to take those measurements at home. It comes back to the care team. They can identify changing needs, change a medication without that patient, their caregiver having to go back to the clinic just to have that touch point. So part of it is on that side. And we, our job is to make that easy And so to get devices into the home that are just easy for the patient to use. We don't want it to be, how do I pair a Bluetooth device to my phone? And do I have a data plan? And do I have internet? All of those barriers can be removed where they just take their blood pressure and the data magically transmits. And then we work a lot on the health system side. How do they access that data in a way that's integrated to their workflow and makes it easy for them?
Yes, for sure it's the interconnectability part, and to be able to say, hey, I can give you a device. We know even Bluetoothing my own earbuds sometimes is difficult if you get
like 1 in 4 times, you get in your car, you can't pair your Bluetooth AirPods to your car, right?
Correct.
So frustrating.
So frustrating. So these devices, I believe, probably have chips in there, Wi-Fi cellular directly connected to your platform, and then that gets synchronized into whichever electronic medical record system that the physician are using. Are you guys are all agnostic to all platform nowadays?
We work with all the leading electronic health record platforms, and are continuously bringing in new medical device data. Yeah.
That's perfect, because we know a lot of good stuff are popping out. We're seeing a lot at the conference to be able to partner up with them to make sure they got into the hands of the right people, and you guys are being able to collect the right data point back to the physician to really help shorten the distance and faster track of the patient care.
Right.
Now, how have you been truly going to market to make sure that everyone actually are using this and people are actually gaining the benefit?
Yeah, so it can be hard, as a patient for me to say to my doctor, I've got this device, I'd like to share the data with you, right? So we have found that we're better off coming the other way and going to the health system and saying, we can enable you to monitor and engage your patients when they leave the clinic. And so while sometimes I think, we as consumers want to just be able to share all of our data with a doctor, that's hard for them with the enterprise systems that they use. So we sell to the health systems, they then deploy it to their patients. One thing we do is we'll actually help staff that for them because they may not have the care management team and the nurses they need. So we can come in, show them best practices, and actually provide the nursing staffing if they need it.
That's great. We know shortage in healthcare is such a big issue, and the pandemic even made that worse.
Right.
So being able to also supply the virtual care from that care management, nursing side, who can have these multiple touch points with our patients. So then when the information gets to the provider side, we have a whole information to say, oh, now I understand. Now I see the trends. And not just that one touch point when they actually come to the office or show up to the hospital.
And to identify, what that patient needs, right? Is their blood pressure not well controlled because they couldn't refill their prescription? And that's the issue that needs to be solved. And, or do they need to change their medication, or do they need to come back to the clinic? So we really try to help, from an access point of view, get them to that right level of care that they need.
Are you guys specializing in certain disease subspecialty, or it pretty much covers everything?
We work pretty broadly across the chronic disease space. So all of the cardiometabolic diseases, diabetes, hypertension, heart failure, obesity, fatty liver disease, and then chronic kidney disease and the respiratory, COPD, and asthma. So that's a lot.
That is a lot.
Most of the big ones.
Yes. And when you're thinking about growing a company, it's exciting. It's identifying the problem, especially as a physician, and then now thinking in the shoes of your patients and being able to deploy this. But it always have its ups and downs. So if we can give you a magic wand that can wave and one thing just magically disappear and truly help you to move this forward, what could that be?
You mentioned the sort of staffing shortages on the clinical side, nurses, doctors. We have the same thing on the IT side, right? A lot of these health systems are just understaffed, and it creates this long backlog of new projects they want to do. I wish we could unstick that, because it's preventing getting the technology into the hands of clinicians and their patients that can benefit them. So that part's frustrating, right? Of they identify a solution that will help patient outcomes, and it might take them 9 months to get that in place, or 18 months to get that in place. So I'd like your magic wand to work on that.
Yes, it's the thing we always say, hey, we know what to do and the purpose of it, but the actual action, taking it there, it's been slower than we implied or hoped or expected.
Right. Sort of shortening that adoption cycle. It's something we think a lot about from a clinical point of view of there was this great Institute of Medicine study of it takes 17 years for new evidence to be adopted generally. And like, if that happens in digital health, like we've all failed, right? It takes 17 years to see broad adoption.
Correct. Now, we all love events. That's why we're here.
Yeah.
And then connecting with amazing people, having conversations. So what truly brought you to Vive, and what are you hoping to get out of it?
We are primarily here to connect with healthcare providers looking for solutions to these patient care problems, right? And they know technology's out there. They need to meet with companies like ours to understand, how do we meet that need? How does another competitor meet that need, and find the best technology partner for them?
That's amazing. Thank you so much for all the things that you guys been doing and sharing with our community. And I'm sure people are going to want to look up what you guys do particularly and perhaps have a conversation. How can they find you?
So they can find us online, Rimidi, RIMIDI.com. Yep.
Perfect. Check them out, and thanks for sharing.
Thank you.
Now, what did you think about her solution with Rimidi? Is it something that you already seen and heard before, or something perhaps you're already adapting, whether it is from a clinical small practice standpoint or a physician, ACO, or even a large hospital system? We would love to hear from you. So comment below wherever you're listening and watching this. We'd love to hear your experience of how has remote monitoring and chronic disease management been able to improve or hold you back from engaging with the patient. Now, that's our first interview. And if you believe you have a great story to tell, we would love to hear from you. Apply as a speaker at theprovidersedge.com, and we would love to spotlight your innovation in the forefront of change. Now let's move to our second speaker, Jeffrey Fallon, who has taken a different perspective of engaging with patients with different tools. Especially we know when you are being hospitalized, sometimes it can be the boring place to be, because besides the alarm going off left and right, if you're getting out of bed, then is what is happening. You're seeing multiple physicians and care team all at one time. Sometimes you don't even know who's coming into your room. Jeffrey's company is able to connect with smart TV, with wearables to help update the progress that you have in the hospital. And therefore, as the clinicians, we can reduce amount of updates for the nurses to constantly going in and out the rooms instead of focusing on delivering the medication, the care plan that we have created, and make sure people are able to get discharged appropriately with the right information. Now, let's hear about Jeffrey's solution. All right, we're back at Vive with Jeff, and thank you so much for being here and representing eVideon.
Well, thanks, Sabrina. I'm happy to be with you and chat with your listeners today.
Yes, we are having a fantastic time and then learning about so many solutions in the healthcare space. So tell us a little bit more about your mission and what made you create the company.
Yeah, so our mission is really to reimagine what's possible for nurses being efficient and satisfied and effective in their work in hospitals, and really to reimagine what it's like to be a patient in a hospital bed. When you're a patient in a hospital bed, you've got very little information. You've got a terrible entertainment experience generally. And so we modernize that. We use a smart TV on the wall and modern entertainment stuff. And then we connect it to the electronic medical record to push information to the patient about their stay, to automate education, prepare them for life after the hospital, and do things that the nurse would normally need to do manually and automate them so that she doesn't have to do that at the bedside.
Exactly. Definitely from a clinician perspective, we always want to have shorter lengths of stay because we know there's a lot of issues when you stay on the hospital longer to even catch the bugs. So we wanted to make sure people stay safe and then prepared to go home so they don't come back. So the education part is so crucial for the nurses to be able to provide. But they're busy. They're giving out meds. They're doing a lot of things to spend the time. So glad that you guys are capturing that. How do you really decipher the right information to educate the patient?
Yeah, the source of truth for everything we do, Sabrina, is the electronic medical record. Whether it's Epic or Oracle Cerner or Meditech or whatever, we integrate our software to the IT systems of the hospital. Primarily, it's the electronic medical record. It could be real-time location systems, but all of these really important backbone IT systems that the hospital's invested in are critical to make sure that we're putting the right information in front of the patient at the right time to prepare them for life after the hospital. I don't want to focus just on what we're doing for the patients. It's really about the caregivers, right? So nurses are incredibly important caregivers. They're stretched incredibly thin in hospitals. So what we're also doing is we're digitizing some really important clinical tools in the room. So the first one I'll talk about is normally a dry erase whiteboard on the wall of the hospital room, and it's a manual thing for the nurse to fill it out. And it's often said they spend about a half an hour every shift keeping these dry erase whiteboards up to date, and they're woefully inadequate or inaccurate, I should say. And the minute they're handwritten down, they're often out of date, right? Things change quickly. So we present a digital whiteboard. We call it the Insight Digital Whiteboard on the Vibe Health platform, and it prompts the nurse with information that he or she would normally look up on the electronic medical record before they walk into the room, or drag a workstation on wheels into the room. So this dense array of clinical information for the nurse is there for him to see when he's in the room with the patient. Now, the patient can do things with the whiteboard too. They might have goals for their stay. And they might write those goals normally on that whiteboard. And so they can use their smartphone to post those goals up on there. But we'll also use tablets right outside the room, also integrated to the IT systems of the hospital, so that everybody that walks up to the room knows what they're about to walk into. The patient is in quarantine or in the process of dying, or no male caregivers, or nothing by mouth, something like that. It's shown graphically right on this tablet. And that's coming from those sources of truth.
Yeah, exactly. We understand that nurses have a lot of responsibilities, and to be able to cut down the manual activities is definitely very valuable. And at the same time, for the patients become involved in that delivery system, and therefore it seems like a cohesively dance to be actively participating in their own care and having that right snapshot for them. Now, since you guys have been in running with producing, engaging with doing these great benefit with nurses, what has been some of the bigger wins for the company?
Well, we're just proud of the work we're doing every day with innovative hospitals across the country. We work with the VA and Department of Defense and some major innovators, big names in hospital systems. And we're proud of what we're doing with every one of them. I'd say that one of the things we're most excited about is when we light up things like this digital whiteboard and the digital door sign, and we see the smiling faces of the nurses and the verbatims that they say, the things that come out of their mouths, like, I've been saying this for 20 years, that we needed to have this. They're using magnets and colored flags and sticky notes outside the door. When they see these things turn on and they realize that a red light around the tablet can let everybody know that the patient is in isolation and therefore you shouldn't walk in. It's like a hallelujah moment for the nursing organization, who just realizes that their job is going to get easier. So that's what we're most excited about. That, of course, the outcomes, like, many of our clients are stating, as I said earlier, nurses are saving 30 minutes a shift on not having to fill out the dry erase whiteboards, but also non-clinical tasks that we can route to non-clinical people to take care of. So if the room is too cold, or they need a glass of water, or a blanket, or the room needs to be cleaned or something like that, the patient can request that stuff without hitting the nurse call button and stopping the nurse from doing clinical work. We can route that through our interface to the right person to come take care of that, the non-clinical person. And then even better than that, we can reach back to that patient, say an hour after they requested the glass of water, and say, Sabrina, you asked for a glass of water. Did you get that yet? And if you say yes, then it's simply logged. If you say no, then it can be escalated, so that we make sure that the hospital gets Sabrina what she needs in the hospital bed. Those are the things that we get really excited about and proud of. Making a difference. That's our mission, is to make a difference for nurses and the patients they're caring for.
Right. It's both the patient satisfaction side of having that checkpoint, where before it would be taking the charge nurse going to door by door to see how they're doing. Now we can really track it by the progress of what they are, and then creating a measurable result and not just the survey that usually the hospital give out to patients. And especially from a clinical perspective, we have measurements. For my post-op surgical patient, we want them to be walked 4 times a day. But as you're saying, if people typically have a whiteboard or dry erase on the outside of the door, it's not really a great way to track, because if the patient walk themselves is something else, how do you know if something is truly done? But now we have a way to actually prove that things are being done, or if things are being delayed, for your example, and people are able to follow up, which is amazing. So has that been something you guys been going to market by connecting with all larger organizations? How do you get the nurses truly see the benefit and the hospital adapting to this?
Well, we have a range of things that we enable on our platform, just kind of out of the box. Best practices that our hospital clients all over the country do. And often hospitals are quite happy to have these really innovative, they've never done before kind of things out of the box. But they also have some ideas of their own that we're able to integrate into this. So you were talking about mobility, and it reminds me of something that a couple of our clients use, something called a mobility wheel. It's a visual kind of analog wheel of the patient's current and aspirations for mobility, the sort of status of their mobility. And we're able to put that up on the electronic whiteboard in the room and automate that so that they have a visual representation of how are they doing and what's their goal. So I'd say that ability to hear the ideas that the hospital has. Now, they were doing that in a manual way before, like with a piece of paper. Hearing that and then automating it and bringing it to life on a digital display in the room, so it's no longer a manual process. That's kind of the way we roll in innovating with our clients and applying their best practices and their icons and their colors and their designs for this stuff.
Right. Everything is coordinated to the brand because it elicits a feeling, a alignment in how they perceive who they are to the patients. And now, if you have a magic wand and one of your biggest challenges can disappear, what would that be?
I wish I could make financial obstacles disappear for hospitals. It's just a reality that we've got a health system in financial crisis, and everybody, I think, when they look at what we do, they say intuitively, yeah, this is something we really need to do. It may or may not be the right time financially for them. Like if they're about to switch electronic medical records, it's tough to want to deploy this stuff if you're not integrating to the electronic medical record. So I would just love to be able to make the financial difficulties go away for them, of course. But that's not going to happen real quickly. And there's no magic wand for that, unfortunately.
Right. It's policy changes, integration, interoperability, everything that we go into. How do we truly improve the whole health system? And that can be very difficult. And yet, we're all doing our little parts, our own, to help facilitate that. Yeah,
we're proud to look. If we can make a 3% improvement in the nurse's time every day, that's monumental. I mean, the nursing organization is one of the biggest expenses for any hospital system. And if we can give 3% plus of their time back from non-clinical tasks toward clinical care so that they have more time to be face-to-face with patients. This isn't about taking them out of the face-to-face thing. This is about giving them less time face down in a computer and more time face-to-face with the patient at the bedside and caring for people. And that's, in the end, what everybody gets into healthcare for, I believe, is caring for people. And the topic of your discussion here today is caregivers, and we're just proud to serve caregivers and applaud your effort to do the same.
Yes, appreciate it. Now, we all love events, and that's why we're all here. And how come you choose Vive, first of all, and then what do you hope to get out of them?
So this is the first time our company has exhibited here. We've got a booth and we're meeting with a bunch of hospital leaders. I attended it myself in Nashville because it's still a relatively new conference. And I came away impressed, not just with the attendance, but really the quality of the conference. I think the venues they choose, the way they run these conferences, it's an enjoyable experience. It's not a chore. What I hope to get out of it is really just to meet more hospitals and talk to more hospitals about what we're doing and what are they challenged with and how we might be able to help.
Exactly. It's really about getting to the right decision maker, let them see the possibility and the benefit from the whole nursing community in order to be less stressed and then better patient direct care. So definitely appreciate you for everything that you guys have been doing. So how can people learn more about you guys or connect with you?
Well, if here at the Vive conference, walk up to our booth. It's V1244. Our website is www.eVideon.com. I'm pretty active on LinkedIn. Feel free to reach out to me directly. I'll connect you with anybody inside the company to make a difference.
Amazing. Thank you so much for your time, Jeff.
Thank you, Sabrina.
All right. So we know point solutions has been talked about a lot, and not many have been specifically talking about in-hospital involvement with potential integration to make the workflow easier, to keep patients more informed so they can be able to be more engaged with the care and be able to not stay in a hospital like it's a hotel, but actually participate in all the right therapy and follow through so they can actually go home and be discharged. Now, what do you think about what the two solution has presented? Are they something that you already heard about? Is something that perhaps you're already using, or something that has been a novelty? Do you believe that they can help you to create better patient outcome, reduce hospitalization, and perhaps have more patient satisfaction as well as clinical team satisfaction as a whole system come together? Would you raise your hand to ask for more information, or you are in the place to say, that sounds great, but not really for us? We would love to hear your story and opinions why you would go for either way. Make sure to comment below or tag me on LinkedIn, Sabrina Runbeck. We would love to continue this amazing conversation. If you haven't subscribed to our channel, make sure that you ring the bell and click on subscribe wherever you're hearing and listening to this discussion. And we would love to hear your proposal of the options you perhaps created for different cost-saving solutions in the health and wellness space. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.